Hi, my name is Soun, and I am a therapist and the community program manager at Yellow Chair Collective, which is a psychotherapy group practice that has a special focus on the Asian and Asian American communities. Today, my presentation is on addressing the social determinants of health in the AAPI community. Oftentimes when we think of health, we think of it as this very individualistic endeavor. The onus is on each individual person to ensure their health and well-being. But actually, health has a very social nature, and there can be a lot of larger forces that affect the well-being and health of individuals. And we can call these greater forces the social determinants of health. So according to the U.S. Health and Human Services Department, the social determinants of health are essentially the conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. There are 5 different domains that this department has designated to represent the different social determinants of health. So the first is economic stability. This means having enough steady income and enough resources to essentially secure your basic needs such as food, housing, healthcare, and transportation. There's also education access and quality, so things like having access to educational resources and quality education can play a really important role in health. Education equips folks with the knowledge and skills to understand health information and to make informed decisions about health in the healthcare system. And then also education levels are also highly correlated with other social determinants of health like income levels and where you live. Next is healthcare access and quality. So this is referring to the geographic proximity, affordability, and availability of healthcare providers that can really influence a person's ability to get the care that they need. Then there's the neighborhood and built environment. So this is essentially the idea that where you live affects your health and well-being. So for example, do you have access to healthy foods, or is your community walkable? And then the final domain is social and community context. We're social beings, and the relationships that we have with our friends, our family, and the broader community around us can really affect our stress levels, our behaviors, and determine the support we receive. So I want to talk about 3 different ways that we can address the social determinants of health, specifically for the AAPI community. So the first one is to recognize the diversity of the AAPI community. There's often this assumption of homogeneity within this community, but there's actually a lot of difference and inequity between this community. So what I mean by that is this community represents so many individuals from different ethnicities, different languages, backgrounds, socioeconomic status, but then when we lump all these folks together, we're not able to provide adequate or accurate resources. The next piece is to challenge the model minority myth. So this is that idea that Asian Americans, through their hard work and innate capability, are able to achieve success educationally and financially, and so they're seen as the model minority. But this myth actually leads to the dismissal of a lot of the challenges faced by this community and can lead there to be less efforts to promote the care of this community. And then finally, I think addressing health as a social reality. So this could look like having more expansive assessments as you're assessing for patients. Are you including SDOH related questions, and also providing culturally sensitive care? So being attuned to the different challenges faced by different communities and including that within the treatment you provide. Thanks so much.